Hi, good morning. I'm Isaac Felix. I'm the invigilator for the OET test conducting on the 19th of May 2020. May I know your name, please?
Hi, good morning. My full name is Gordon Victor.
Can I have your passport, please?
Yes, sure.
Can I have your candidate number, please?
My candidate number is 198767.
All right. We can now begin the warm-up session. How do you respond when family members ask for your personal diagnosis?
Unless it's my role to diagnose, I wouldn't do so. But I would try to dig in a bit and figure out why the patient's family member was inquiring. Does the person need some validation? Did the doctor not explain the prognosis clearly? I'd seek to be helpful and share important information without stepping outside of my role.
How have you dealt with conflict?
I do my best to de-escalate the situation. If the conflict involves a patient's family members, I separate the parties by taking them out of the area. I then listen to both parties to find out about the issues and how they can be resolved. I will also escalate the problem to a senior staff member if necessary.
How do you define a good shift?
A successful shift for me is when I have delivered the best care to patients. It is also a shift where my team and I have the capacity to take the required breaks, which provides a less stressful environment.
In your opinion, what are the best and worst aspects of nursing?
In my opinion, one of the best things about being a nurse is helping a patient to get to good health after they have received the highest standard of care. The hardest thing is where a patient continues to suffer from pain, despite all interventions.
Describe how clinical rotation prepared you for a career in nursing.
I learned a great deal of invaluable information at my school. Rotations taught me intangible skills, such as bedside manner, by providing me with practical experience of dealing with patients.
That's the end of the warm-up session. Now we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now. Time is up. You can now start your role play.
Good morning. I am the Richard, one of the registered nurses on duty today. For more confirmation, how may I address you?
Hi Richard, you can call me Edward.
All right, Edward, how are you feeling today?
I would say that I am not very comfortable at the moment.
Oh, I am sorry to hear that. May I know how I can help you?
I am feeling really uncomfortable with the catheter.
I apologize for the trouble you are facing, but, from your case notes, I found that you are suffering from pneumonia. Therefore, the doctor prescribed you with antibiotics and electrolytes to maintain your body's water electrolyte balance.
You might be right. But I really don't want a catheter.
Okay, if you don't mind, could you please explain to me the reason for your uncomfortable feeling towards catheter?
Well, these needles are hurting me a lot, and I don't wish to get hurt. Moreover, it's too irritating. Why can't you give me some sets of oral antibiotics?
All right, I can understand your concern, but in your case, it's very necessary to take IV medication, as it gives a faster result than oral medication. So, for time being, it is important to stick on with IV medications.
Yes, you might be right, but you should understand that I have a phobia for needles.
Oh. Is it? Could you please explain to me about it?
I started to get strange feelings for needles when I was a teenager. My fear rooted after being stabbed by a heroin drug addict who attempted to steal from me.
All right, I can appreciate your worries. But in these IV catheters, there are no more needles. We remove the needle once after placing the catheter in the right place. So, nothing to be worried about the needle and catheter. Am I clear to you?
All right, but still this is hurting me a lot.
Yes, on assessment, it is evident that due to increased mobilization of your hand, the catheter has been misplaced. So, for elevating your pain, I am supposed to introduce a new catheter to another hand. Hence, you will be relieved from pain and discomfort.
Oh my God. Another one. How long would I have a catheter in my body?
Mostly the catheter will be there until the completion of this set of antibiotics. Hopefully, you may get faster recovery if you follow our instructions.
At the moment, I am not very confident about recovery. Because I am still experiencing pain and there is a ringing sensation in my head. Moreover, I am feeling very cold and unable to stop shivering. I don't feel that I am going to recover from my disease in this hospital, as if my experience overnight is terrible here.
Don't worry about the progress of recovery. The doctors here are very expert in dealing with all these kinds of respiratory illnesses. Furthermore, you are being treated by our best doctors.
All right, kindly please provide me with some pain medications, and do something for my shivering.
Yes, of course, I can help you out, don't worry. Now itself I will inform the doctor regarding your pain and discomfort. Do you have any further concerns?
Yes, yesterday, I asked with one of your nurses for an extra cover sheet, but she didn't respond to me yet.
Oh. I am really sorry for the inconvenience caused. During some night duties, nurses are very busy, and I believe that they have unfortunately forgotten about your request. But don't worry, I can provide you with a warm blanket right now. Is there anything else I can help you with?
No, but please inform the doctor about my pain.
I can assure you that the doctor will reach you in a few minutes. Does that sound good?
Yes. Thank you.
Great. In a moment, I will be back with a blanket.
All right. Thank you for your concern.
It's my duty to care for you. Kindly press the bell on your right side if you need anything, or when you feel uncomfortable. We, nurses, are here to help you.
Thank you for your kindness.
You are very welcome.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.